Months into the COVID-19 pandemic, it is still frustrating that so many who want to get tested for the coronavirus haven't been. People are turned away because their symptoms are mild or because they aren't elderly. Others lack prescriptions. Some don't know where to go or don't have a car for drive-up options. One of our own, Dr. Ayla Stanford, a board-certified pediatric surgeon, has taken the matter directly into her own hands by providing and administering coronavirus testing to communities and neighborhoods who need it the most. Thanks to the heroic efforts of Dr. Stanford, people who might not have otherwise been tested have been. Dr. Stanford has led a full enterprise going directly into neighborhoods and epidemiological hot zones where the virus has disproportionately impacted people of color. In order to broadly host free testing clinics throughout Philadelphia and surrounding communities, Dr. Stanford created Black Doctors COVID-19, a consortium that goes door to door, neighborhood to neighborhood, in a rented van administering COVID testing. Dr. Stanford is a true force of nature. She attended Pennsylvania State University for her undergraduate work and received her medical degree from the Penn State College of Medicine. She trained for residency at the State University of New York Downstate Medical Center and the University of Pittsburgh in general surgery. She then completed fellowship training in pediatric surgery at Cincinnati Children's Hospital Medical Center. Dr. Stanford is double board certified in general adult and pediatric surgery and has over 20 years experience maintaining a busy community-based surgical practice. Dr. Stanford was named the Philadelphia Business Journal Top 40 Under 40 Award. The City of Philadelphia named her for the Next Generation of Women Leadership Award. The City of Philadelphia has much love and admiration for Dr. Stanford, and so do we. Dr. Stanford has inspired a nation with her dedication and commitment to taking medicine directly to patients who need her the most, and we are delighted that she will share her story here at our first virtual APSA national meeting.
It makes me angry to see the lack of attention, the lack of importance putting on these African American lives, the fact that I feel like I have to fight so hard to get basic equipment and testing.
I think this is something that was long overdue, but I'm hoping that we can get the support that we need in terms of PPE, reagents, testing, materials, so that we can continue to serve the community.
This is day 4 of running the operation. We've got 200 people on the parking lot even before we open.
Getting our results back already, and there are a lot of positives, which is why we're doing this every other day. So it just takes us a minute to make sure everything is accurate, that we can call people promptly, give us a day to replenish, refuel, and then get back out there the next day.
Well, we've been testing at about 60 an hour. We've got doctors, med school students, nurses, people who just care about our folks.
I mean, I have nurses that are here working and they have a 3 o'clock shift. You know, people who are feeding the homeless and then coming here in the afternoon. As long as I'm healthy and I've got a healthy group of folks and they're motivated, we are going to keep going.
Hello, everyone. Greetings from Philadelphia.
I am Dr. Ayla Stanford, a pediatric surgeon in private practice. And today I'm going to talk to you about representation and equity during COVID-19. So like many of you, I was watching lots of CNN and MSNBC, and then something came across in my local newspaper that said that African Americans count for more than a third of the deaths. It made me pause. And immediately I began to call the city officials, state officials, Congress people I knew through friends of friends to say, what are you doing? How can I help? Because we were only doing emergency cases and I had some free time and I really wanted to help. And unfortunately, what I heard were crickets. So I started to think about how, one, you could educate. And so I did more social media than I've ever done in my life and contacted friends of mine to come up with this is what you can do to protect yourself in community, and posted that. I hosted live chats with young folks and old folks in the community and through my church to dispel the myths. There were so many myths out there. Then this article came out from Drexel University, and it basically said that if you lived in an affluent neighborhood, you were 6 times more likely to be able to get a test. And I'm like, okay, so the folks who have more diagnosis and more death of coronavirus can't get tested. And I started getting lots of calls from friends and friends of friends saying that they tried to go get tested and they were turned away. And here's some of the list of things that happened. You had to have an appointment. The hours that were scheduled to get tested were not conducive for working class people. They were still asking if you had traveled to China and Italy. They were only testing healthcare workers. If you took a bus or a subway or train, which many people do in Philadelphia, and you got to a testing site, they were only taking you if it was a drive up and you were in a car. And then you needed a referral. And many African-American patients did not have a primary care doctor, or if you had a referral and you went to a hospital and your doc wasn't on staff there, they also wouldn't test you. And I was just going out of my mind, like, this is not going to end well if we don't break down some of these barriers. And so I reached out to my institution where I'm on staff and said, how did you guys create your pop-up units? And basically I said, okay, I need PPE, I need personnel, and I need testing kits. And all my friends who are private practice docs, I drove around, I picked up all their testing kits for coronavirus. I reached out to everyone in my phone and friends of friends, medical students, people from sororities and other organizations. We had a Zoom call of health professionals, over 30 people, and I discussed wanting to get out there and test people in a mobile unit. I put a link, said it was free testing, that you could come out and get tested. In the beginning, we had a small number, about a dozen folks. And because it was such a small number, we literally drove to people's homes and we tested them in the hard hit communities. And so once ultimately I was able to get more testing kits from LabCorp, because as a private practice doc, I had an account like any other person or like a hospital. And I pleaded the case that African Americans were not getting tested in Philadelphia and that the locations were not accessible and there were way too many barriers. And ultimately, someone was empathetic to my cause and sent out 250 testing kits. And ultimately, as we used the testing kits and sent the specimens back, they continued to replenish the supply. And so why are the rates higher in African American communities? And most of us who have been a doctor for over 2 decades now know that we've heard all the things about the social determinants of health and how economic instability and your neighborhood and physical environment and education and all these things can lead to you having poor health outcomes. And so why the higher rates? It had to be a reason that was deeper than the history of African Americans in the United States, the lack of trust, and that we do poorer with certain diseases. So I knew access to testing was an issue. And then the biggest push was stay at home. But most African Americans were the ones driving the bus, delivering our mail, working in the grocery stores, cleaning the hospitals, working in the hospitals. And so there wasn't an option. There wasn't an option to buy food for 2 weeks at a time because many people could not afford to do that. And they needed their income to support their families. So they were the ones, as I call, the face front employees that were keeping our nation running. So the message was stay at home, but they really couldn't stay at home. Then the other part was that they're multi-generational households where you have a young child and you have an 81-year-old grandmother, right? And you're all living in one environment and it's hard to isolate. And then, of course, there's a medical system that many don't trust. And there were so many mixed messages for everyone. First, it was don't wear a mask, then it was wear a mask, then it was respiratory droplets, now it's airborne. We know about implicit bias, we know about overt bias, and things like that. But I thought, what are the things that I could actually change rather than the things that were here long before I was on this earth? So obviously, good hand hygiene, washing your hands, wiping down surfaces and things like that, minimizing the shopping trips, all that education stuff I put on my website. The shelter in place, it was difficult. And many public health experts will tell you that the strategy that was employed for this particular unique population is not uniform and can't be followed, and something more intricate needed to be brought forth. For example, when you're in a multi-generational household and someone is positive, having places for individuals to go and be isolated and quarantined so that the entire family isn't infected. So then it became test, 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 and to get the resources to the hardest hit communities. So for us, the testing gave an opportunity for individuals to know their status, to isolate, for us to help them with the contact tracing so they could reach out to folks, and then for them to be quarantined, that we could really decrease the spread. But the resources were not getting to the hardest hit areas. And so I reached out to the city, and it was published on the website, and we got the hottest zip codes in Philadelphia. And I partnered with my pastor's church and said, we need to find a church in each one of these zip codes. It's a place where people trust. It's a place of refuge. It's a place that they know. People can walk to it. They'll see people there that they recognize, and it may help bridge some of the trust and bring forth comfort that they would come out to get testing. So the first time we drove, the second time we tested 122 people. By our third site, we tested over 350 people in one day. These social determinants of health, I was determined that we could do something about. Education, I talked about that. Social media is a powerful tool. Word of mouth is a powerful tool. Getting it up on church websites was very helpful. The healthcare provider, I was very purposeful about the name for our organization and called it the Black Doctors COVID-19 Consortium. And it wasn't by accident, because I realized that we were reaching out to the hardest hit population in the city of Philadelphia, and that was African Americans. And yes, the elderly was also at risk, and yes, our healthcare workers were at risk, but the greatest percent of those who were being diagnosed and dying were the African American population. Specifically, we represent 44% of the population in Philadelphia, and we're dying at a rate at 55%.
I'm here to get tested, and I just want to say it makes us so proud when our doctors that look more like us get together and to service us. It makes us feel so proud, because other places we've been going to, we've been getting turned away because we didn't have the symptoms, or we have the symptoms and no one wants to service us. So I'm just grateful that the Black doctors here are looking after us. Thank you so much for all you do and your hard work.
Well, you asked a question about it. I felt more comfortable coming to my people. And basically what I'm saying is, they're probably going to come across something that someone else would not notice. And I'm not trying to be funny about it, but I feel more comfortable with my own people. Plain and simple.
So the other things we could do, access. Again, we were in the communities. People walked, people rode their bikes, people got the bus, people carpooled together, households. So we had the access part down in terms of transportation and physically getting there. We did not require a referral. Every patient that was tested was under my MPI, and ultimately I was responsible and my team for contacting every person. The medical bills, we did not charge for the service. So when LabCorp said, well, what are you gonna do with the folks that don't have insurance? I said, you're gonna bill me. You're gonna bill me as the provider, and I'm gonna figure out how I'll get reimbursed later. But I'm not going to allow people not to get a test that costs $100 when it could potentially save their life, their neighbor's life, or someone else in our city because they could not get a test. So I assumed that responsibility. The community engagement, the churches were on board. The quality of care. I have had anesthesiologists, gastroenterologists, pediatricians, family practice docs, other surgeons, critical care folks who have volunteered their time. Nurses with 25 and 30 years experience, medical students that want to do a lot, which I won't let them do, all show up. We have our follow-up is robust. We are calling people within 48 hours with their results. We're doing our version of contact tracing, at least to get it started. And we are bringing resources to the hard-hit communities that I have to say have yet to come from the city of Philadelphia. The data set we have is invaluable. So we have tested over 4,000 people in 15 sessions. So we, in essence, test every other day. That just gives us, initially, it was because we needed a day for the supplies to be delivered. We also realized it's a day for us to rest. It's a day for us to call people back because we're at 48 hours for the prior days. And we, on average, are testing upwards of 300 people a day. 98% are African American. In all the years I've been a physician and been part of research, I've never seen a study where 4,000 people were African American, nearly 98%. And I should mention, the folks that volunteer are not all Black doctors. The people we test are not all Black, but we are certainly in African American communities. Our highest positivity rate was 24%. And many of you have heard Dr. Fauci mention the outpatient positivity rate being between 18 and 20%. So we were above that as we were hitting our peak in Pennsylvania. And our overall percentage now is 12.4%. Most of the numbers that folks are discussing are 10% and lower is safe to go back to work. And we're not there yet in Philadelphia at all. Another great thing that has come out of this is that in New York City, Representative Hakeem Jeffries with Governor Cuomo, in essence, did the same program that we're doing. In Houston, it happened. Baltimore churches reached out to us and asked how to do this, and they're now doing it, and also in Ohio. And I'm very proud of the efforts that we've been doing, and people have been mimicking. Some other anecdotal things about the data, and I can't present all of it. I'm noticing in certain neighborhoods, everyone had insurance. I mean, everyone had insurance. So the notion that people don't have primary care doctors and they don't have insurance who are African American is not universally true. Many of the people who came, their doctors sent them to us to get tested. And so that in this particular area had everything to do with access and resources. Nothing to do with whether you had a PCP or health insurance. The other anecdotal notes, we had many nurses who came, police officers who came, and grocery store clerks who came, who had to sneak out of work and come over on their breaks when they could get there to get tested, because at their places of employment, nurses would say, everyone's sick. It's not really encouraged for us to get testing. The testing hours are off hours. We can't get there. It's not easy. And our supervisors are afraid if we get tested and we're positive that we're not going to be there. It's going to decrease our manpower. We had police officers that we called to tell them they were positive. They were more concerned that they were going to get in trouble for not notifying their supervisor that they went to get tested. And I said, listen, you got to protect yourself, and you can't be protecting and serving if you are out here in the public interfacing and you have coronavirus. We're also seeing many children, which again goes back to the multi-generational household. And when you ask who was positive, they'll tell you the grandparents were positive and the children now have it. And of course, now we're making sure that they're not having skin rashes and other things that may be consistent with the vasculitis, other inflammatory conditions we're now seeing in children, and many children have died from. When we go to the churches, it's not uncommon for the pastors to tell us that they lose several members a week from coronavirus. So when you hear it's time to go back to work, folks just need to wear masks, it's just not the same in African American communities. When people say the positivity rate is decreased, we've got a long way to go. We don't know what our positivity rates are. Some of the challenges that I've faced, which I have never had to face, the politicians, I now see a lot of them just want to be reelected. So they want to jump on to be part of the movement, but they want to make sure you come to their district and test. But their district may not be a hot zone. And so I'm not swayed to go there, even though we do need resources and funding, because it's your district. For the academic institutions, again, I started reaching out to say, what resources do you have? Do you have any extra PPE and things like that? I have to say, in a pinch, Abington Jefferson came through and gave us testing kits when we ran out one day. Other institutions reached out and said, hey, you've got the relationship with the community. We have a mobile van. You have a mobile van. Let's go to the churches together, and we will test all the people with insurance, and you can test all the people without insurance. And they thought that was truly a viable option. More examples than I could really count. Another institution promoted that you go to their testing site by using our name. And that's the other thing that I found, is that even though the city has 47 testing sites, which I have to mention, all of the testing sites came after our consortium was on MSNBC and ABC News and Good Morning America and all these other outlets. Then all of a sudden, the city had more testing sites. However, it coincided with the signing of the CARES Act. So now, if you tested someone who was uninsured, you were guaranteed to get reimbursed. And then it changed. Now, all of a sudden, we had tons of testing sites. We would be at a testing site, and literally 2 blocks away would be a city site, and we'd have hundreds of cars, and there would be no one there. I say that's a testament to the trust that we have built in the community. I'm really proud of what we're doing. Resources, thankful to my surgical colleagues who I come home and there are gowns on my doorstep and boxes of gloves on my doorstep. I'm very grateful. The funding and what we have to keep us going right now is all from grassroots. People giving us $5 here, $10 there. We had a GoFundMe. A couple private entities have sent us checks, but to date, lots of town hall meetings, lots of webinars, lots of conversations with the city, the state, the federal government. I have yet to see any of that funding, but we didn't wait. I just believed that in the midst of the worst pandemic in my lifetime, these tests were going to be covered. And some would say that was a risk, but I would say it was necessary. The advantages is that I'm able to, and we are able to provide unfiltered knowledgeable information. And so often you're unable to do that because you can't talk if you work at a certain place, or you're in fear of losing your job. And that's not something that I am. And grateful to be a voice for so many who don't have a voice. I believe it's a unique dichotomy that I'm in because I was born and raised in Philadelphia and grew up in North Philadelphia, which is one of the poorest parts of the city, and then was fortunate enough to become a physician. And so there's no fear for me to go into a neighborhood where I was raised and where I was brought up, and to bring my doctors and colleagues and nurses and students with me. My biggest fear is contracting coronavirus disease. And knock on wood, it's been a month and I don't have any symptoms, but there's no fear for me. And so when I speak about the people in those communities, it's a common story, it's a common journey that I can share with my colleagues and with politicians, but yet still be able to sit at the table with the epidemiologists and the MPH folks and the docs and the people that are creating the public policy and say, you got this part right, but you got this part all wrong, and really try to create new policy. That's my goal from all of this. And the next steps, which goes back to the data, 4,000 people. If we stopped today, we've already accomplished something magnificent that we are going to, my plan is in the next 3 to 6 months to be able to be testing for antibodies for all these folks who are in our database, to make sure every single one has a primary care doctor and they have access to whatever health insurance may be available for them for their situation. And that we don't just stop with the coronavirus testing, but we try to move the needle on those other healthcare outcomes like the breast cancer and diabetes and prostate cancer and cardiac disease and colon cancer and so many other where the outcomes are poorer for African Americans, to really educate and advocate for a group that has really been marginalized, again, longer than I've been on this earth. This has been awesome to be able to talk to you about representation and equity. And both of those words are positive, because in Philadelphia, I felt as though 1 week we were talking about African Americans being disproportionately affected, and the next week we were talking about going back to work, as if somehow the disease prevalence had changed and the amount of death had changed, and it had not. And equity, moving towards everyone having an opportunity to get a test that needs a test. So you have an opportunity to protect yourself and protect your family and get the treatment you need, and honestly protect everyone, because you're not in the public continuing to spread unknowingly when we know the diagnosis rate is higher in your community. The other part we did is we were collecting ethnicity data, and unfortunately our city was not. And we're not unique. Many cities and states throughout the United States were not collecting ethnicity data, and you knew that things were horribly wrong when they were digging graves in New York for all the bodies. And they were primarily African American. So I felt, with all the years of training that I've been so blessed to have, and all the mentoring and education that so many were not, that I had a chance to speak up for my community. And it has filled me up more than I could ever imagine. And I'm so committed to doing this. And I really thank you for giving me the time to share this with you today. Thank you, APSA.